Lecture 16 Oversensitive Patients, page number 119-120.
In the 63rd and 64th paragraphs, Hahnemann treats of the primary and secondary actions of medicine. There is no necessity for dwelling upon this subject. The primary and secondary actions of a drug are simply the one action of that drug. Some homeopaths have attempted to individualize between the primary and secondary action. It does not matter what the patient is suffering from symptoms which appeared in the primary action or from symptoms which appeared in the secondary action, that drug will cure just the same. The symptoms that arise are the symptoms that arise from the remedy, and they often seem to oppose each other. In the earlier stages, we have sometimes sleeplessness, in the last stages, sleepiness, and one state is sometimes more prominent than the other. For instance, in opium, some provers had sleeplessness first and sleepiness afterwards from the smaller doses of opium. It is known that opium has both sleeplessness and sleepiness, and if the doctor, if the other symptoms agree, it does not matter which one of the two is present. If opium is indicated by the general state of the patient, it will cure either of these conditions. And you need not stop to see if it produces one state in one place and the opposite in another. In some provers, opium produces diarrhea in the beginning, in others constipation. If I should take today a crude dose of opium, in 6 hours I would have a diarrhea that would last for several days and then be constipated for 6 weeks. To know that drugs have two actions is simply knowing the nature of the drugs in general. So some remedies are having two types of opposite actions: constipation and diarrhea, sleepiness and sleeplessness. Temporary కాదు, ఆ ఒక్కదాని కోసం ఇప్పుడు మిగతా టోటాలిటీ ఆఫ్ సింటమ్స్ మీద బేస్ చేసి ఈ పేషెంట్లో వీడికి స్లీపీనెస్ ఎక్కువ ఉంది కదా, నిద్రమత్తు ఎక్కువ ఉంది కదా, లేకపోతే నిద్ర లేదు కదా, ఈ ఒక్క దాన్ని బట్టి మిగతా సింటమ్స్ని బట్టి ఇండికేట్ అయినప్పుడు ఈ రెమెడీలో రెండు ఉన్నాయి. ఇప్పుడు ఫర్ ఎగ్జాంపుల్ మామూలుగా ఏమవుతుంది, ఓపియం మనం when we have given some tranquilizer, what happens? In its primary action, it produces sleep normally when it is dissimilar. So automatically the person gets to sleep. But in the secondary action, what happens? Even after taking the tranquilizer, sleep will not be there. So, but in homeopathic primary and secondary action, normally what he explains is, in the primary action, this natural disease will be cleared because of the production of the artificial disease, which is similar to natural disease. So automatically the constitution will be affected with the artificial disease in the primary action. In the secondary action, what happens? The vital force itself will clear the drug disease. So that the vital, because of that only Hahnemann and Kent and Max Winke, they have explained that the disease will be cured only by the vital force, not with the drugs. But in what way the drugs will help? They will awaken the weakened vital force. That is possible only by administering similar remedies. Because of that only, similar remedies are only capable of curing completely a disease. The patient is having more sleepiness. If the other symptoms are not similar to opium, we have to think of. Or if the other symptoms are completely similar, and if the patient is having either sleepiness or sleeplessness also, we can give opium. either constipation or diarrhea also, we can give opium, because opium will produce in some patients constipation, in some patients diarrhea. To know that drugs have two actions is simply knowing the nature of a drug in general. You will find another example in alcohol. Watch two drunkards and you will see the double action illustrated. There are constitutional states in patients by virtue of which they are always affected in a certain way, and these states are often left after proving, and are found in those who have been poisoned by a drug. There are constitutional states in patients by virtue of which they are always affected in a certain way, and these states are often left after proving, and are found in those who have been poisoned by a drug. After completing the proving, the patient need not get cured of his previous health condition. When it is possible, if the proved remedy is similar to his constitution, then only he will be cured. All these patients will have alternating symptoms which will confuse the physician before he knows their constitutional state. It is an important thing to know the constitutional state of a patient before prescribing. So sometimes because of the alternating states, there will be a confusion in the condition of the constitutional condition of the patient. You will always be able to do better for your patients when you have all of their tendencies. Of course, in acute diseases, symptoms sometimes stand out so sharply that an acute remedy can be administered without reference to any constitutional state. Acute cognates can be established in almost any patient. For instance, the calcaria patient will need an acute cognate of calcaria when he is sick with acute symptoms. The acute symptoms fit into and are established and formed by the constitutional state of the patient.